Today, we're talking about interdisciplinary care, what it is, why it's absolutely essential in wound healing, and how bringing the right team together can completely change a patient's outcome. By the end of this video, you'll know exactly who to bring into the room, when to bring them in, and how to make teamwork actually work in real-world settings. Ever feel like you're doing everything right for a wound, but it's still not healing? You change the dressing, you debride it. You follow protocols, but something's missing. Here's what I've learned. You can't heal complex wounds in isolation. Wounds don't need a hero, they need a team. For those who don't know me, I'm Dr. Voltaire, a wound care physician. And I've worked with patients where the turning point wasn't a new product or special dressing. It was when podiatry walked in, or when nutrition showed up, or when a nurse noticed something others missed. That's what this video is about. Learning how to use the strengths of the people around you to bring healing that lasts. If you're just getting into wound care, or if you've been doing this for a while and feel like something's still off, this will help you. You don't have to be the expert in every specialty. You just have to know how to build the right team and why it matters. Here's what we'll walk through together. Why interdisciplinary care matters more in wound healing than almost anywhere else. Who should be on the team and when to call them. How to communicate without chaos. And a real case where the team saved the wound and the patient. And at the end, I'll give you my go-to framework to make teamwork easier in any care setting. Let's start with the truth. Most wounds don't heal because someone puts the right dressing on them. They heal because of what's happening around the dressing. So blood sugar control, nutrition, mobility, mental health, vascular flow, and social support. None of those things can be managed by one person. That's why interdisciplinary care is the foundation of good wound healing. It's not extra. It's not if you have time. It's a standard of care. Let's build the team together. Here are the people I bring in regularly. Nurses. They're the eyes and hands of wound care. They see changes in real time and help with dressing application, education, and prevention. Physicians and nurse practitioners are involved in diagnosis, medical oversight, managing infection, and coordinating care plans. Podiatry is involved in offloading, debridement, surgical input, and foot structure insight, especially in diabetic wounds. Infectious disease can be critical when wounds are complicated by systemic or deep infections. Endocrinology does a great job with helping manage diabetes, which impacts healing at every level. There's also nutrition and the dietitian. Healing is biologically impossible without protein, calories, and key nutrients, and they help with figuring that out. PT and OT helps with positioning, pressure relief, mobility training, and building independence. Vascular surgery is there to evaluate and intervene in poor blood flow, which stops healing before it starts. In certain cases, you have social work and case management, because if the patient can't afford supplies, transport, or housing, even the best wound plan will fail. Mental health can be a huge factor, so depression, anxiety, and burnout affect adherence, energy, and outcomes. You might not have all of these in every setting, but the more you bring in, the more tools you have. Let me tell you about someone I once saw, Miss L. She had a sacral pressure injury, which was stage 3. The dressing was fine, debridement was happening, but every time we made progress, it stalled. Then someone said, she's barely eating. We brought in nutrition, and they found out that she was only getting 25 grams of protein a day. Then someone else said, she slides down in the chair constantly. So PT came in and switched her to a better wheelchair. They added a wedge, and the wound began to shrink finally. The lesson is the dressing wasn't the problem. The body needed support from every angle. Don't wait for a problem. Bring them in early if you can. Call vascular if pulses are weak or ABI is borderline. Refer to nutrition if the wound is chronic or draining heavily. Loop in mental health if the patient seems withdrawn, angry, or hopeless. Get podiatry involved if the wound is plantar or complicated by foot shape. You'll never regret adding someone, but you might regret waiting too long. Okay, so how do we actually make this work without confusion? Try this framework. Designate a lead. Someone has to own the care plan. It might be you, the wound care specialist, the primary, or a nurse care manager. Keep communication short, regular, and clear. Weekly team huddles are helpful. Shared EMR notes, if you can. Quick updates are great. Document roles and responsibilities. Who's monitoring blood sugar? Who's ordering dressings? And most important of all, include the patient. Make them a team member too. Invite them to understand and contribute. Collaboration isn't chaos, it's structured listening. Let's do a quick walkthrough. Imagine a patient with a venous leg ulcer. You've got the nurse assessing drainage and changing the dressing. You have the provider, who could be you, managing edema and ordering compression. You have the dietitian, making sure the patient has enough protein. You have physical therapy, helping them walk safely to reduce calf muscle pump stalling. You have a vascular specialist reviewing whether reflux or occlusion is a barrier. A social worker, maybe helping with compression wrap coverage or follow-ups. And the patient learning how to elevate the legs during the stay and stay adherent. That's not fancy care. That's standard wound care done right. Here's what I see go wrong most often. We wait too long to call for help. We assume we'll be seen as weak, or we worry about overstepping. But in wound care, waiting usually means worsening. So let's flip the mindset. Bringing in more people isn't weakness, it's wisdom. You can't know it all the time. If you want your wounds to heal, not just look better for a week, but actually close, you need a team. Healing is about pressure, blood flow, protein, glucose, movement, belief, and access. And no single clinician can handle all of that. So build your team. Start with what you have and never underestimate the power of shared care. Thanks for watching. If you like this video, check out my next one where working in a team made all the difference. Stay informed and heal well.